Hello to all, I am Vandana, clinical instructor at Khalsa College of Nursing, Amritsar. Today I am here to discuss about the topic cholelithiasis. Chole means bile, lith means stone and lysis means formation. It's defined as the condition in which stone formation occur in the gallbladder. Most of people have gallstone most of people have gallstone, they have no any symptom, so it's asymptomatic. Next, firstly we have to discuss about bile. What is bile? Bile is a greenish and yellowish secretion produced in the bile which store in the gallbladder, and it's help in the digestion. So firstly we have to discuss about the bile composition. Bile consists of the 70% bile salt, 10% cholesterol and 5% phospholipids. So liver and gallbladder both have one duct, and it's connect into the common bile duct, which help in the transfer the bile from gallbladder to the small intestine, and which all are helped in the digestion of the food. Those food which contain the fats, carbohydrate and other material. So nextly we have to discuss about the type of cholelithiasis. It's mainly three type. First is cholesterol cholelithiasis, second pigmented cholelithiasis, and third is mixed cholelithiasis. So first is cholesterol cholelithiasis, which mainly most of people suffer from the cholesterol cholelithiasis, which mainly in yellowish color. Next, pigmented cholelithiasis, which mainly seen in brown and black color. And last is mixed, in which include both cholesterol and pigmented cholelithiasis. Next, we have to discuss about the causes of cholelithiasis. Firstly, we have to discuss about the 5F. First, fear, fat, female, 40 and fertile. Firstly, fear. Those people who have white skin tone are high chances of the cholelithiasis. Next is fat. Fat deposition is also be have high risk of the cholelithiasis. Next is female. Female have more chances of occurrence of the cholelithiasis as compared to the male because of the estrogen production in the female. Next is 40. Above 40 age females have also be high risk of the cholelithiasis. Next is fertile. In those cases who have multiple pregnancy are also be high risk of the cholelithiasis. Next is rapid weight loss. When any person do the rapid weight loss, this leads to disbalance and have a high risk of the cholelithiasis. And the last is obstruction of gallbladder. When any obstruction is occur in the gallbladder, that leads to the stuck the bile in liver or bile ducts, which leads to occurrence of the cholelithiasis. Next, we have to discuss about the pathophysiology. First, due to the etiological factor or liver disorders that leads to the decreased bile acid secretions or synthesis, which leads to improper cholesterol breakdown, and it's not digest in the good way, which leads to the increased cholesterol synthesis, and which result is supersaturation of the bile with cholesterol, and which result is not soluble, which leads to sedimentation and precipitation, which will form the stone formation in the gallbladder, and which result is to inflammation of the gallbladder. Next is sign and symptom. Clinical manifestation of the cholelithiasis. First and the main sign and symptom is pain, which occur in the upper right quadrant. It's starting from slow and then slowly increased in the intense. Next is jaundice. Jaundice occurs due to the excessive accumulation of the bile in the blood vessels, which leads to the jaundice occur. Next is urine color change. Pale to dark urine color change is occur. Next is stool color. Stool has no any color and it's called hypopigmentation. Next, and other causes are heartburn. It's occur due to indigestion and inflammation of the gallbladder. Next we have to discuss about the diagnostic test, in which include the blood test, ultrasonography, MRCP, that is magnetic resonance, cholangiopancreatography, and the last is ERCP, that is endoscopic retrograde cholangiopancreatography. So firstly we have to discuss about the USG, ultrasonography. Ultrasonography is a simple and non-invasive test that we have to use to see the inflammation of the gallbladder. Next, MRCP, magnetic resonance cholangiopancreatography. It is also be a MRI type and which help to the visualize the bile duct. Next is ERCP. ERCP is an endoscopic retrograde cholangiopancreatography, which is more invasive technique which mainly used to remove the gallbladder with the help of tiny camera and its help to the remove the gallstone bladder. Next, we have to discuss about the medical management. In medical management, only one medication is given to treat the cholelithiasis, that is urodeoxycyclic acid. In infusion, we have to infuse the methyl tertiary butyl ether. Next is surgical management. In surgical management, we have to use the laparoscopic cholecystectomy and the open surgery. In laparoscopic surgery, we have to use the laparoscope and removal the stone in the gallbladder, and in open surgery we have to cut the small incision on the gallbladder and then remove the stones in the gallbladder. Next is next and last is prevention, in which we have to improve our diet and improve the life modification. Firstly, we have to avoid the fat and oily substance which leads to increased cholesterol level. Next, we have to avoid the red meat and initiate the fish as replacement of the red meat to the fish, because red meat have high lipid and cholesterol level while fish is highly omega 3. So it's all about the cholelithiasis and types, causes, sign and symptom, and management of medical and surgical management and prevention of the cholelithiasis. Thank you.